Ever had a doctor push you to crank up the intensity on a patient even when it doesn't feel right? Yep, I've been there too. It's a common problem in physiotherapy that can lead to burnout, ethical dilemmas, and poor patient outcomes. In this video, we'll explore practical strategies to handle these situations while prioritizing patient safety and your well-being. I thought the hardest part of becoming a physio was memorizing all the muscle origins, insertions, innervations, and actions. But as a working physio, one of the hardest things we do is deal with angry, pushy doctors. It doesn't happen very often, but when it does, it can hit you like a ton of bricks. In this video, we'll dive into the nitty-gritty of navigating these tough conversations with grumpy doctors. From understanding the physician perspective to advocating for the patient safety, we'll cover the effective communication strategies that you need, explore how to maintain positive professional relationships, and even share some bonus tips on how to stay safe and avoid burnout. So if you're ready to level up and become a better physio, keep watching. Section 1, Decoding Doctor Drama, Why They Push and How to Dodge. Nobody wants to get that angry phone call from some doctor who pushes for more aggressive physio treatment. Face-to-face confrontations are even worse. It can be a tough spot to be in, especially if it hasn't happened to you before. But before we dive in on how to handle this situation, let's take a moment to understand why some doctors may do this. Doctors are under pressure too. Most family doctors are just trying to keep their patients alive, keep them happy, and get them out of the office. Orthodocs expect all their surgeries to recover spectacularly. So when patients don't meet the doctor's expectations, it must be the physio's fault. They can't blame themselves. They can't blame the patient. I'm the physio. It's my fault. When I try to understand the doctor's perspective, they're not evil. The doctor just wants the patient to do well. We all want our patients to do well. The typical advice is to empathize with the doctor, educate the doctor on what the physio can do realistically with this patient, and clearly communicate our physio concerns about the potential risks of being more aggressive with treatment based on the evidence, so that you can build a better collaborative relationship with this doctor. But my experience is that all this is baloney. In reality, these doctors are just venting their anger about something that may or may not even be a physio issue. They won't hear a single thing you say. So don't waste your breath. When a doctor yells at me about their patient not doing well in physio, my best approach is to stay personally and emotionally safe by saying something like, I understand your concern. I will work on this when I see this patient next. Let's talk about effective communication strategies you can really use. Section 2, Calming the Storm, How to Handle Difficult Doctors Without Losing Your Cool. Dealing with a confrontational doctor can be a real challenge, but here's the thing, you don't have to let their behavior get to you. Just because they're having a bad day doesn't mean that you have to have a bad day. By prioritizing your personal and emotional safety, you can maintain a professional relationship, advocate for your patient's best interests, and not rage quit out of our profession. So how do you do it? Well, it starts with active listening. When a doctor is pushing for a more aggressive approach, then give them your full attention. Avoid interrupting. Really try to understand their concern. Paraphrase what they said to ensure you've understood correctly. Remember, don't talk back. It's not about being submissive. It's about not escalating the situation. If you must explain your choices, then clearly and concisely explain your rationale. Emphasize what you think is the best thing for your patient. In theory, we should spout off about some evidence-based research to support your recommendations, but I doubt you've got that at your fingertips. And in the middle of an argument, nobody cares about your research articles. Remember, pause before reacting and choose a response that de-escalates the situation rather than adding fuel to the fire. Here's a simple and effective phrase that I've used to acknowledge the doctor's concern. I understand your concern. These 5 words can go a long way to diffuse the tension and create a sense of mutual understanding. Another great phrase that I use is, I will work on this when I next see that patient. This phrase demonstrates that you're committed to addressing the doctor's concerns and improving the patient outcome. I have a few more tips to make your conversation even better. Maintaining a calm tone and relaxed body language show that you're composed and professional. There'll be time to be emotional later. Avoid taking the doctor's behavior personally or getting defensive. This can escalate the situation. They don't care about you, they're just angry with the situation. Take a moment to collect your thoughts before responding. A brief pause can help you choose your words more carefully and respond more constructively. Take a breath, you've got this. Part of being a physio is advocating for what's best for your patients. The next time your doctor is pushing you to kick it into overdrive, take a breath and collect yourself. Remember, it's not about being a doormat, it's about being a savvy physio. Don't talk back, to lash out, it won't help anyone. Instead, focus on finding common ground. What are the shared goals here? Patient recovery, right? Let's work together to achieve that. I've found that care conferences to be a valuable place for addressing patient compliance issues. When I've documented a lack of home exercise adherence, I've used these meetings to have an open conversation with the doctor, the patient, and hopefully the family about the importance of the patient's active role in their own recovery. After all, a positive mindset and consistent effort are crucial for their successful rehab. However, outside a formal care conference, there isn't always an ideal platform to directly educate the physicians about the importance of patient engagement for our physio success. Two things keep coming up when I think of great communication. First is active listening. Really tune into what the doctor is saying. Don't just wait for your turn to speak. My teacher friend always tells me, I need your full attention, friends. Second, empathy. Put yourself in their shoes. Understand their perspective, even if you don't agree with it. This is the idea that we're all in this together. We all have patients that we need to take care of, and we need to seek common ground. By combining these strategies, you can diffuse tense situations and build stronger relationships with these doctors. But when a doctor suggests something that makes you want to step back and wonder, maybe there is something fishy going on here. Trust your instincts, keep your patients safe, and be respectful. Let's talk about not burning our bridges here. Section 3, protecting your physio patients, navigating risky doctor requests. When a doctor insists on more aggressive physio approach and you're not comfortable with it, it can be tricky. But don't panic, that's part of the job, and here's how to handle it. Here are some tips to help you navigate this sticky situation. First, focus on patient safety. Explain your concerns about the patient's safety and well-being in a non-confrontational manner. Use phrases like, I want to ensure we're prioritizing the patient's safety, or I'm concerned that being more aggressive may increase the risk of complications. I've also used, I don't want to make the patient worse. Offer alternative solutions. If you have alternative solutions that prioritize patient safety, now's the time to bring them up. Use phrases like, have you considered, or I'd like to propose maybe we do this. Remember, it's all about finding a sweet spot between being assertive and respectful while steering the treatment in a better, safer direction. For example, one doctor was demanding I see his patient 3 times a day for 7 days a week. There was a number of reasons why this wasn't reasonable, but instead, I just said that we could do 5 days a week, once a day for 5 days a week, and that was feasible, and we'd get that scheduled with the patient. As it turns out, the patient had transportation issues and can only come once or twice a week anyway. Seek support if necessary. Don't be afraid of seeking support of a supervisor, a colleague, or administrator. Tell the doctor you're working on a solution with your team to find options for the patient outcome. The best place to work is those places where you've got that backup and support. Remember, prioritizing patient safety and advocating for what's in their best interest is not only the right thing to do, but it's also a key part of being a physio rock star. Don't be afraid to speak up, seek support when needed, and always keep your patient's success as your guiding principle. I know some physios fear upsetting the doctor because the doctors give us the referrals, but you're still bound by your conscience and what you think the best thing for your patient is. Do the right thing and limit your exposure to toxic people. Look, I know we all know that being a physio isn't always sunshine and rainbows. Sometimes it can feel like you're juggling chainsaws while riding a unicycle. That's why it's important to take care of yourself. Bonus section, protecting your peace, prioritizing emotional and personal safety in physiotherapy practice. We all know that physio can be intense, but your emotional health is just as important as your clinical skills. Remember, you deserve to be treated with kindness and respect, so prioritize your own emotional and personal safety. Don't tolerate abusive or disrespectful behavior from others. Set limits and speak up. When faced with difficult people, remember these 4 lessons for prioritizing your emotional and personal well-being. Set clear boundaries. Establish clear limits on what you're comfortable with in terms of communication and collaboration. It's okay to say no. It's okay to have limits. Maintain a healthy distance. Prioritize emotional well-being by maintaining a professional distance from difficult situations and toxic personalities. Don't take it personally. It's not about you. It's about the situation. Maintain physical safe distance between you and the angry person. Aim for at least an arm's length away. Seek support and safety. Don't be afraid to reach out to colleagues, mentors, and supervisors for guidance and support when dealing with difficult people. don't go into a closed room with an angry person. Whenever possible, have somebody nearby for backup. Prioritize self-care and trust your instincts. Hey, don't forget to breathe, take breaks, grab a cuppa, and chat with friends to keep your soul happy. Trust your instincts and prioritize your safety. Your well-being is important, so stay safe. You'll be able to help your patients in the long haul. One last thing, documenting your conversation. This is crucial. When you talk to the doctor about a patient, make sure to note the details in the patient's chart. You need a paper trail. When writing medical notes, keep the following best practices in mind. Be objective, stick to the facts, and avoid subjective interpretations. Be brief. Keep your notes concise and to the point. Avoid unnecessary details or tangents. Use simple language. Avoid using jargon or technical terms that might be confusing to others. Instead, use clear and simple language that's easy to understand. Be timely. Make sure to document conversations and events in a timely manner when the details are still fresh in your mind. Here's an example of how you might want to document a conversation. 7 July 2023, phone contact from Dr. Jones. He expressed concern about limited patient progress. I reviewed our physio goals and plan. We discussed potential options and next steps. Francis Olivier, PT. Or you can add details about what those next steps are supposed to be. Maybe a physio reevaluation, maybe adding heat and manual therapy, maybe scheduling more visits with the patient. Documenting what happened and what to do next provides continuity of care and protects you in case of misunderstandings. And if some other physio sees the patient next, there's a note about the doctor's concern and the future physio plan for that patient. That's why we document everything, right? If needed, most places have a formal incident reporting process. If you feel that the situation compromised your safety or the safety of others, then fill out an incident report. This helps ensure that the incident is documented and investigated. Workplace conflict is a real issue that nobody talks about. I've been in some sticky situations, so I know this is a crappy topic for a video, but it's important to stay safe and be aware and take care of yourself in all these situations. That's why I'm making these videos. This is the advice I wish I had when I was starting out as a physio. Let me know if this helps you. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Another video for you to chew on right here, and by subscribing, you'll be part of a vibrant community that celebrates everything physio. Thank you.